I hope everyone can see my screen.
Yes, I can see the presentation coming up. I can still see the PowerPoint part of it. Are you
Yeah, yeah,
going to
yeah.
open it up into a larger presentation so we can see the letter?
I'm opening the slideshow.
Okay.
Yeah, now slideshow is on.
There we go. I can see the
So
full presentation now.
yeah, it's okay. Okay, and now we're gonna start. So basically, the topic of today is extremely important topic, although the topics we have selected so far from last more than 1 year, since I joined Atlantic International University as a teacher. So the topics they have given me and the topics we and the college university administration select, most of these topics are extremely important topic and high impact topics. They are not the topics which if we do not know about, then it makes no difference. No, these are the topics, if we uh, make a good understanding about, it changes our lives, it changes everyone's life around us. For example, every household, every human being comes from a mother's womb. So you can't have a sister, you can't have a wife, you but you can never say that you don't have a mother, because we are the children of our mothers. So our mothers give birth to us. There is no other way that we come into this world. There might be some cases when we don't have a sister. There might be some cases when we don't have a wife. There might be some cases when we don't have some other female relationship, some other relationship with a woman. But we can't say that we don't have a mother. We are the children of our mother, and the maternal health and the taking care of a mother when she's expecting and when she's about to give life to another human being is an extremely important aspect of our life. So basically, this lecture series is maternal and child health, and this is part one of this lecture series. We will focus on the health and well-being of expecting mothers. So today's class will be entirely focusing on the health and well-being of expecting mothers. As you already know, majority of you already know who I am. I'm Dr. Omer Farooq Khan. I'm a Bachelor of Medicine and Bachelor of Surgery. I'm a resident orthopedic surgeon doing my residency training in Benazir Bhutto Hospital, which is a major teaching hospital in Rawalpindi, Islamabad, Pakistan. So the learning objectives for today's class, without wasting even a single minute. So first of all, we will introduce what we're gonna talk about. Then there will be some basic definitions. Then we'll talk about you're about to get pregnant. Now what? Then first trimester care, genetic testing, foods to avoid in pregnancy, exercise during pregnancy, second trimester care, third trimester care, and vaccination in pregnancy. So all of these things are extremely important, and all of these things play an important role in the well-being and development of a healthy baby and well-being of the mother who's about to give birth to the newcomer into this world. Introduction. Having a baby is an exciting time that often inspires women to make healthier lifestyle choices and, if needed, work toward a healthy body weight. When a woman gets pregnant, her whole body physiology changes drastically, and there is a rush of hormonal as well as physical changes in her body, which can be challenging for many females. Taking care of a mother's health while she's pregnant is extremely important aspect of pregnancy care, as she's not the one individual but two, or in some cases three individuals. The way a mother's pregnancy progresses It entirely reflects in the newborn child's health and wellness. The way a mother's pregnancy progressed, it is reflected in the health of the newborn child. If a mother was nutritionally deficient, if a mother was a smoker, if a mother was a drinker, if a mother was a gambler, or if a mother was physically abused or emotionally detached or abused, then the newborn will show all the deficiencies, all the signs of those abuse, all the signs of those problems will reflect not only in mother's health, but they will also reflect in the health of the newborn as well. So, healthier pregnancies are associated with very less complication rates as compared to those pregnancies where mother's health and well being was not the primary concern for the family or care providers. So, basically, if a mother's pregnancy is healthier, the healthier the newborn is. And if the mother's pregnancy was full of complication, whether physical, whether gynecological, whether emotional, then all of these complications will reflect in the newborn's well being as well. The newborn will show signs of mother's illnesses. The newborn weight, the newborn's health, the newborn's sleeping habits, the newborn's feeding habits, the newborn's immunity, everything will reflect how a mother spent her pregnancy time. So, this is my style of teaching. I always talk about basic definitions first before going into the details of the topic we are going to talk about. So, basic definitions. Pregnancy. What is pregnancy? So, pregnancy is the condition during which one or more offspring develops inside a woman's uterus. A multiple pregnancy involves more than one offspring, such as with twins or triplets. Pregnancy usually occurs by sexual intercourse, but can also occur through assisted reproductive technology procedures. So, basically, what is pregnancy? Pregnancy is a condition during which one or more offspring develops inside a woman's womb or a woman's uterus. Pregnancy can exhibit a single alive uh, fetus, or it can show twins, or it can have triplets as well. But all of these offsprings are developing inside a woman's uterus. Conception. The process of becoming pregnant involving fertilization of a female egg with male sperm, followed by implantation of embryo inside woman's uterus. So basically, what is conception? The way when we talk about whether some female conceived a baby or some female conceived pregnancy, what is the meaning of conception? The process of becoming pregnant involving fertilization of a female egg with male sperm followed by implantation of embryo inside woman's uterus. And what is a trimester? We will keep talking about trimesters. So we should know what is a trimester. The 3 month periods of time in pregnancy is called trimester. They are referred to as first, second, or third trimester. Gestation. The word gestation is implied to define the period from fertilization, whether in vitro, in lab, or in utero, in woman's uterus, to birth. On the other hand, the word pregnancy should be used when referring to the period after implantation has been completed. So the gestation is the period from fertilization to birth, and pregnancy is the period from implantation to birth. Implantation means the implantation of the fertilized egg into the uterine wall. That is the meaning of implantation. Miscarriage. Miscarriage, also known in medical terms as a spontaneous abortion, is the death and expulsion of an embryo or fetus before it can survive independently. The term miscarriage is sometimes used to refer to all forms of pregnancy loss and pregnancy with aborted outcomes before 20 weeks of gestation. Prenatal or antenatal care. So, prenatal or antenatal care is the health care you get while you're pregnant before the birth occurs. So natal means the process of birth, and prenatal or antenatal means before the process of birth. So if you are getting help before the process of birth, or if you're getting any kind of health care before the process of birth, that is called prenatal or antenatal care. Both the terminologies are used interchangeably all around the world in different textbooks of the kind of obstetrics and gynecology. So, towards our topic, and that is you are about to get pregnant. Now, what? In this section, we will discuss all the details regarding prenatal, antenatal care of a pregnant woman. You are about to get pregnant. Now what? If a family is planning to get pregnant, or if husband and wife are having unprotected sexual intercourse routinely in order to get pregnant by God's will, then the female should be taking a healthy diet, including plenty of fruits and green leafy vegetables, along with meat and dairy products as well. For example, if you're a married couple and you're planning a pregnancy and you are having unprotected sexual intercourse all the time in order to get pregnant, then if there is no pathology in the female's reproductive system or male's reproductive system, you are destined to become pregnant any week or any month. Then what should you people do? Because if you are not getting pregnant in this month, you may get pregnant in the coming month or in the next month ahead. So what you need to do if you are having unprotected sexual intercourse in order to get pregnant, what should you people do? Well, the female should be taking a healthy diet, including plenty of fruits and green leafy vegetables along with meat and dairy products as well. So female should be preparing herself for the pregnancy, and she should use diet rich in vitamins and minerals and all kind of essential nutrients, including proteins as well. So she should be taking fruits, green leafy vegetables, meats, dairy products, eggs, dry fruits, etc., and plenty of water as well. So what will happen? She will be at her optimum level of nutritional health when she gets pregnant. So there will be less chances of nutritional deficiencies in the first trimester. Prenatal vitamins, especially folic acid intake, is extremely important during first trimester of pregnancy, and they should be started by the female if she's expecting to become pregnant soon. So green leafy vegetables and fruits, they also contain good quantities of folic acid. But if the patient is suspecting that she is about to become pregnant or she has become pregnant, then she should start taking folic acid after her healthcare provider's guidance and advice. And she should be using green leafy vegetables which are already rich in folic acid. Folic acid is extremely important in first few months of pregnancy because it helps in the development of brain and spinal cord. So if there is folic acid deficiency at the start of pregnancy, then there are many neural defects seen in those children whose mothers were deficient in folic acid when they got pregnant. Adopt healthy habits. Start taking healthy foods, avoid unhealthy habits such as alcohol intake, cigarette smoking, over the counter medications without physician's prescription. So avoid all the unhealthy habits. You should stop alcohol intake, you should stop cigarette smoking, you should avoid all kinds of medication without asking your healthcare provider whether they are safe for the baby or not, because there are some over the counter medications which are prohibited in pregnancy, especially during first trimester. They may be teratogenic as well. Start taking a good sleep, meditate, and do light exercise regularly as well. So you need to take a good sleep, you need to meditate, if you are religious, you need to go to the church or you need to go to the mosque, whatever your religion is. So, and you also need to take care of your diet. You also need to take care of your sleep. You also need to avoid all the bad habits if you have any, and you need to do light exercise regularly as well. So all of these things will give your pregnancy a very good start, and these things are not taught everywhere. These things were not taught to us when we were in our medical school. We were taught about the diseases, we were taught about many other things which were not necessary, but we were not uh, told about the holistic approach towards a pregnant woman. And this is the holistic approach that I'm trying to teach you people, that whenever you are giving some advice to the person who is about to get pregnant, you should know how to give advice to that person. Pregnant mothers must get enough nutrients and energy when they conceive. First trimester care. When a woman has missed her period dates and she has tested positive for pregnancy twice through performing pregnancy tests, she should make the first obstetric or antenatal visit to the nearby hospital dealing with obstetric cases right away. Ideally, the first obstetric OB or antenatal visit should happen approximately eight weeks after the first day of your last menstrual period. Usually, most of the females have their menstrual cycles 4 weeks apart. So their period dates are roughly 4 weeks apart from each other. They menstruate on every 28th, 29th, or 30 or 31st day of their calendar. So basically, when they miss their period, it's almost 4 weeks of duration when they first know that they are missing their dates. And then there are 2 to 3 weeks after that date when the first pregnancy test, the urine pregnancy test, becomes positive. So basically, the first visit usually happens approximately 8 weeks after the first day of your last menstrual period, and you confirm that you are pregnant or not. That happens around 6 or 7 weeks after the first day of your last menstrual period. There are some blood tests and there are some urine pregnancy tests which are positive even after 5 weeks after the first day of your last menstrual period, but usually it's 6 weeks after the first day of your last menstrual period where your pregnancy test clearly becomes positive. Urine pregnancy test clearly becomes positive, and urine releases HCG, human chorionic gonadotropin hormone, which is detected by urine pregnancy test strips. During the first visit or booking visit, your healthcare provider or doctor will take detailed history from the patient regarding number of pregnancies, any previous medical or surgical history, family history, medication history, allergy history, past gynecological history, and socioeconomic history. So everything is taken into account when a patient goes to the doctor. Their medical history, for example, if a patient is diabetic or not, whether the patient is hypertensive or not, whether the patient is having asthma, whether the patient is having any other medical illness, whether the patient is having diabetes or not. So all of these things are taken into account, and then there is also surgical history that is asked about. For example, if a patient had appendectomy 2 or 3 years prior to becoming pregnant, or if a patient had some major surgery due to some blunt trauma to the abdomen or any other reason. So all of the medical and surgical history is asked. Then family history is asked, whether there is a trend of normal pregnancies in the family, whether there is trend of normal vaginal deliveries in the pregnancies, or the babies are born through cesarean sections, whether there is any medication history, whether the patient is allergic to any medication or any specific thing related to pregnancy. Then past gynecological and socioeconomic history is also asked about. Then the doctor will perform the examination of the patient. Examination will include recording of all the vitals, and vitals includes blood pressure, temperature, pulse, respiratory rate, and mm, oxygen saturation these days as well. And sometimes they also check the BSR of the patient, but it is not a vital. It is basically an offshoot of checking vitals. So recording of vitals means blood pressure, pulse, respiratory rate, temperature, and oxygen saturation of the patient, as well as vital systems assessment will be made. Respiratory system will be checked, cardiovascular system will be checked, her mental status and her brain health will be assessed. These things will be assessed not in depth but superficially. Vital systems will be assessed. The examination will also include detailed pelvic exam as well as breast examination. Then there is ultrasound confirmation after 8 weeks of pregnancy. So ultrasound confirmation will be done once the detailed history and examination have been completed. Ultrasound will show a normal pregnancy with fetus with positive FCA. So FCA is basically fetal cardiac activity. So positive fetal cardiac activity is necessary to establish a normal, healthy pregnancy. So ultrasound will be done within 8 to 9 weeks of pregnancy. That it will show a normal pregnancy with one or two embryos with positive fetal cardiac activity. Your dates of pregnancy will be confirmed as well, and a due date will be established based on this information. So basically, the patient tells that she had her last menstrual period on date 5 of the month, and 5th of, for example, if a patient comes to me and she tells me that her last menstrual period was on 10th of June or 15th of June, and today is 16th of August, and she has come to me for her first OBS gynae visit, or for her first booking antenatal visit, and she tells me that her last menstrual period was 8 weeks prior to that, or 9 weeks prior to that. She had her last menstrual period, first day of her last menstrual period, to be 16th or 15th or 16th of June. Then I will confirm it through ultrasound. I will confirm it, these findings and these dates, with the ultrasound as well. And ultrasound will establish that the patient is telling the truth, and the patient is not forgetting the dates of her last menstrual period as well. Then there is counseling and education, which is provided to the patient regarding pregnancy care and dietary care during pregnancy as well. So the counseling starts, the education of the female starts with the first visit, and it is very, very important. Examination is done in many healthcare setups. Ultrasound confirmation is done in almost all healthcare setups, but the healthcare setups that are lacking these days is the lacking in counseling and education of the new mother. Especially if a female is having first pregnancy, then counseling and education is extremely important. And if she is having second, third, or fourth pregnancy, then she herself has become quite experienced. But if she if it's her first pregnancy, then counseling and education is extremely important, and the patient should be counseled what to expect, how to deal with the symptoms of the pregnancy, how to deal with the stress of hormonal rush, how to deal with the physiological changes in the body, how to deal with the food aversions, how to deal with the food cravings, how to deal with the almost always happening nausea and vomiting. So all of these things, the patient needs counseling, the patient needs support, and the patient should be educated about, should be given proper education or basic education about the changes in the body during pregnancy. Then there are some investigations which are performed in developed world. Yeah, in developed world, mostly in developed world, some unnecessary investigations are also done, such as pap smear is basically the testing of the cervical mucosa for any viral infection or any a bacterial infection, or there is one other class of unicellular organisms such as amoeba and chlamydia, which also cause infections of the pelvic viscera of the females, and they also cause cervicitis. So basically, and there is a pap smear performed, and complete blood count is also performed to rule out anemia or pelvic infection in pregnant female on the very first visit. So, the most common encountered problem during the first trimester is the problem of nausea and vomiting. So, nausea and vomiting in first trimesters occurs to almost two-thirds of the patients, or even three-fourths of the pregnant females, especially during first pregnancy, because body is not used to the hormonal rush. So morning after sickness or nausea and vomiting are very common in first trimester of pregnancy, especially in first pregnancy. Food aversions are also very common. Some homeopathic remedies are there, such as use of ginger, use of vitamin B6. Acupressure wristbands are also helpful for these females. Then there are some allopathic medications as well. For example, the combination of maclizine and vitamin B6, or the combination of doxylamine and vitamin B6. So these are very good combinations, and patients do respond to these medications for the control of nausea and vomiting due to high progesterone levels in the body. Newly approved drugs by the FDA in America are Zofran or Reglan, and they are also very extremely helpful in severe cases of vomitings as well. Taking small and relatively frequent meals is also important, very helpful for these patients. So you need to guide these patients that they can't take routine meals when they could eat as much as they wanted, but not now. They have to eat in frequent but small meals. They have to take frequent but small meals. They can't eat whatever they want. They can't eat how much they want, because it will worsen the symptoms of nausea, and patient may start doing vomitings once or twice daily, and this will impact her eating habits as well, because the patient will become fearful of eating anything due to the fear of vomiting it out later after having excessive nausea. So if a patient is having severe nausea and vomiting and you are not helping the patient, then the patient will become nutritionally deficient, the baby will suffer, the patient will suffer, and the problems will arise with the nutritional status of the patient. So what you need to do is you need to help the patient as much as possible. The nausea and vomiting in some patients can be reduced drastically. They do not vanish entirely, but the feeling can be reduced drastically, and the quality of life of pregnant female can be made better. So this is an algorithm in management of nausea and vomiting of pregnancy, and hyperemesis gravidarum, written here as HG. So nausea and vomiting of pregnancy, we will call it NVP, is common and usually occurs in week 6 to 8 to week 16 to 20 of pregnancy. Hyperemesis gravidarum, HG, can be described as the most severe form of nausea and vomiting of pregnancy. Hyperemesis gravidarum can last the duration of the pregnancy and have complications such as dehydration and nutritional deficiency. Diagnosis. Despite a lack of consensus definition to distinguish hyperemesis gravidarum from nausea and vomiting of pregnancy, and variation in definitions or criteria of hyperemesis gravidarum, current clinical practice is that hyperemesis gravidarum can be diagnosed in a pregnant woman with severe vomiting or severe nausea after other causes have been ruled out. Two tools, the puke and the health scores, can rate the symptoms of NVP and severe NVP, including hyperemesis gravidarum, respectively, aiding management. So, what is hyperemesis gravidarum? Normal nausea and vomiting is common in pregnant females, but there are some pregnant females who are having extreme symptoms of nausea and vomiting to this extent that whatever they want to eat, first of all, they don't feel like eating anything. And if by willpower they eat somehow, it ends up in vomitus. So they vomit everything they have eaten. Sometimes the vomit is 2 times a day, sometimes 3 times a day, sometimes even 4 times a day. It is so debilitating that the pregnant female who needs extremely good nutrition becomes even more nutritionally deficient. So, screening and early in recognition of nausea and vomiting for pregnancy and hyperemesis gravidarum in primary, that is general practice antenatal care, is not routine, which can result in delayed treatment. Yeah, we often overlook, even the healthcare providers often overlook the problem of nausea and vomiting in pregnancy, and they say, no, that's common. It's not a worrisome thing. Once vomiting or twice vomiting daily is a common thing. That woman had it, this woman had it, XYZ had it, but that's not the case. Even if a person is feeling nauseous and not vomiting on daily basis, you need to take it serious and you need to help the patient as much as you can. And then you need to counsel the patient that there might be some nausea and occasional episodes of vomiting still present, but you need to help the patient as much as you can and you need to reduce the symptoms as much as you can. Although it is also part of research that those women who are having severe nausea and vomiting due to excessive progesterone are linked with better outcomes of pregnancy, are linked with easier deliveries, are linked with better child health at the end of delivery. So, if a person is having nausea and vomiting, it means that her hormones are working and a hormonal balance is strong and her child development is good. But you need to control the vomiting and you need to reduce the symptom of nausea as much as you can so the patient can eat whatever they want. You need to help the patient as much as you can. So the quality of life is extremely disturbed. Stress. 18% of women with hyperemesis gravidarum develop postpartum post-traumatic stress disorder. Yeah, due to excessive vomiting for 6 or 7 months, the patient becomes a sufferer of PTSD. They start having nightmares if they think of getting pregnant again. So they are like the patient becomes phobic of getting pregnant again. Although pregnancy is a very good feeling, it's a very fulfilling and very enriching feeling. For a female to become a mother is a physiologically, spiritually, and hormonally and emotionally a roller coaster ride and an extremely spiritual thing to give birth to a child, and it's a kind of fulfilling thing. But if a person is suffering from hyperemesis gravidarum and the healthcare providers are overlooking their problem, then the person suffers from trauma of pregnancy and they become phobic of getting pregnant again. Dehydration and electrolyte imbalance is also common. Hypokalemia and hyponatremia. I will not explain what is hypokalemia and hyponatremia. We have discussed this thing in detail that what is hypokalemia and hyponatremia. Hypokalemia and hyponatremia can lead to cardiac arrhythmias, ventricular fibrillation, and sometimes cardiac arrest as well. Termination. Inability to care for self and family are major reasons leading to 15% of women with a hyperemesis gravidarum terminating at least one pregnancy. Prolonged nutritional deficiencies are common with patients suffering from hyperemesis gravidarum. The low birth weight of the fetus, the small size for gestational age and preterm birth, as well as vitamin K deficient embryopathy and neurodevelopmental delay can also occur in newborns whose mothers suffered from hyperemesis gravidarum and they did not get any kind of help from their healthcare providers. So dietary and lifestyle changes are the usual first line treatment, but if symptoms persist, complementary treatment such as acupressure can be introduced. If symptoms worsen, pharmacological intervention, fluid or nutritional therapy or hospitalization may be required as well. Epidemiology, so variation in definition, variations in definition make quantification of the burden of NVP and hyperemesis gravidarum difficult, but some estimates suggest 70% of pregnant women experience nausea, vomiting, pregnancy, and prevalence of hyperemesis gravidarum is 1%. Thank God, only 1% of the pregnant females suffer from hyperemesis gravidarum. Majority of the females are simply nauseous all the time. They are not doing vomitings 3 or 4 times a day. Women less than 20 years of age and those who are pregnant for the first time experience nausea and vomiting at higher rates than others. And some ethnic differences in NVP have been documented, but data are conflicting. In the UK, annual cost to the National Health Service for the NVP and hypermesis gravidarum are estimated to be as high as 62 million sterling pound. So the pathogenesis is I will not discuss the pathogenesis because it will go beyond the scope of this lecture. So basically, we have discussed all these things, and we do know how to control hyperemesis gravidarum. So I think I will conclude this slide. Now, the genetic testing. The genetic testing is offered in many developed countries where tests are offered to all the pregnant females, which include blood tests, which are performed to rule out diseases like Down syndrome, trisomy 13, trisomy 18, and then there is also a nuchal translucency scan. It's basically nuchal means neck, translucency means the ability of the light to pass through something. So nuchal translucency scan is basically an ultrasound. Nuchal translucency scan is also performed in first trimester, which includes the evaluation of the back of the baby's neck. If the nuchal thickening is present, it is suggestive of Down syndrome. These days, blood tests are also available for the genetic testing of mother as well. Diseases like cystic fibrosis, spinal muscular atrophy, and Tay-Sachs diseases are tested in the mother. And if mother is carrier, if the mother is positive for such diseases, next step is to test the baby's father for such genetic diseases so that the baby does not suffer from such illnesses. Other important investigations to be done in first trimester, especially in high resource settings, is HIV tests. HIV tests are performed usually in regions with high infection rates and sexually transmitted diseases such as syphilis or gonorrhea, especially if either of the female or male or had multiple sexual partners in the past, then sexually transmitted diseases are mandatory to check. Then hepatitis B and C testing, especially in countries where hepatitis B and C rates are high, blood group and RH status of the patient. For example, whether the patient is having an A positive group or a negative group or O positive or O negative, or whether patient is B positive or B negative. That is positive or negative is RH status of the patient is tested to assess the risk for development of erythroblastosis fetalis. There is a disease. I will not go into the details of this disease because it will go beyond the scope of this lecture. But there is a disease uh, of the newborn where if the father is having a positive blood group and a mother is having a negative blood group, then the baby is doomed to suffer from this disease until and unless there is medical intervention which is done to save the baby from this potentially life-threatening illness. Then rubella, varicella zoster, and chickenpox testing is also should be done in some cases. Foods to avoid during pregnancy. A very important aspect of pregnancy care. So it is usually recommended to avoid high mercury fish. So mercury is a heavy mineral, heavy element, which is teratogenic and toxic for the females as well as newborns in first and second trimester. Patients should avoid swordfish, canned tuna, shark, mackerel, etc., as they contain large quantities of mercury in their bodies. Tuna fish sandwich should not be taken more than once per week. To avoid risks of listeria infections, patients should avoid listeria is a bacteria. Listeria monocytogenes is a bacteria which can even grow in the environment of refrigerators. Listeria is the only bacteria which can grow at temperatures as low as 7 or 8 degrees Celsius. 6, 7, or 8 degrees Celsius, Listeria is the only bacteria that can grow and reproduce and cause infections in immunodeficient people. Pregnancy is a state of immunodeficiency, so unpasteurized cheese and milks should be avoided. Raw, undercooked meat and fish should also be avoided to decrease the risk of food poisonings. Deli meats or hot dogs not warmed to steaming should also be avoided. Unwashed fruits and vegetables should always be avoided. So these are the things which should be avoided by pregnant females. So, in order to get a healthier life, in order to get a healthier baby, you need to take care of yourself because mother is not only one being when she's pregnant, but she's taking care of two, or sometimes when there are twins, she's taking care of three souls. So she has to take care about all these things. She has to avoid high mercury fish. She has to stop taking alcohol. She has to stop smoking. She has to stop all the bad habits that we uptake during our lives due to bad companies. She has to stop all those things. She has to take care of her sleep. She has to do light exercise. She has to do meditation or yoga. And if she is religious, she should perform her religious duties as well for the enriching of the soul and for the well-being of her soul. And unwashed fruits and vegetables should always be avoided by pregnant females. So foods to avoid during pregnancy, there is an infographic diagram. Raw meats and seafood should be avoided. Excessive caffeine intake should be avoided because caffeine is harmful for the baby. It is present in coffee. Trans fat and processed oils should be avoided as much as possible. Flax seeds and especially oils should be avoided. Processed meat should be avoided. Certain herbs and supplements are forbidden. Raw sprouts should be avoided because they contain many bacteria which do not cause food poisoning or which do not cause illnesses in normal adult males or females. But as a pregnant female is immunodeficient, so she should take care. She should avoid alcohol, she should avoid smoking, she should avoid high mercury fish, and she should avoid undercooked or raw eggs as well, and she should avoid excessive sugar intake. So these are the things which should be avoided, which are part of our daily food diets, but these should be avoided for pregnant females because they are not beneficial for the babies as well as expecting mothers. Then there is a very important aspect of pregnancy care, and that is exercise during pregnancy. Healthcare providers do not guide the patients about exercise during pregnancy. Even healthcare providers do not care when they are pregnant, especially a female healthcare provider. They themselves don't care about the beneficial effects of exercise during pregnancy. So that is a very important thing. Exercise during pregnancy is considered safe in modern medicine. 5 30-minute sessions of safe exercise are considered good for normal healthy pregnancy. It should be kept in mind that trauma to abdomen or falls need to be avoided at all costs during exercise sessions. Walking, swimming, stationary biking, and yoga are allowed and even encouraged by doctors these days. Contact sports, skiing, actual biking, etc., should always be avoided due to risk to the abdominopelvic areas. For example, if you are having any kind of contact sports such as basketball, football, cricket, rugby, whatever, you should avoid such sports in pregnancy because if you get a hit on your abdominopelvic area, there is a chance you may lose your baby. Skiing should be avoided. Actual biking should be avoided, yeah, because there are risks of falls and there are risks of getting bumps on the road, etc. Heart rate is not as important in exercising females as the feeling of wellness due to workout or yoga. The body is already under too much stress, so the point of exercise is not to increase your heart rate, and the point is not to do cardio. The point is to increase the blood flow through the body and the brain, and to increase the feeling of wellness in the female through workout or yoga. So there are the types of exercises. First type of exercise is cardiovascular exercise, where brisk walking or jogging is the and swimming is present in cardiovascular exercises. Then there are resistance exercises, if, which include weightlifting to increase the muscle strength of the female. Then there are flexibility exercises where you do stretching exercises. Then there are pelvic floor exercises or Kegel exercises as well. So all of these exercises help the woman to prepare for the childbirth and to reduce the complications related to the childbirth. So examples of the such exercises are aerobic or cardiovascular exercises. A purpose is to improve your heart health and your endurance. Brisk walking is there, swimming is there, stationary cycling is there, jogging is there, not running exactly, but jogging is there. Yoga, pilates, and low impact aerobics are also there. And these five examples were the aerobic or cardiovascular exercises. Then there are resistance or strengthening exercises as well. So these strengthening exercises are for muscle toning targeted at certain muscle groups, such as doing squats, lunges, push-ups, modified yoga or pilates, pelvic floor exercises, and there are also some other forms of strengthening exercises for upper and lower limbs, such as using weights or dumbbells and exercises using resistance bands. All of these things help improve the outcomes of the healthy normal pregnancies and decrease the complication rates of childbirth process. Then there is second trimester care. So when a woman enters second trimester, her prenatal visits should keep happening every 4 weeks apart in high resource setting areas and maximum 6 weeks apart in low resource setting areas. So high resource setting areas are rich neighborhoods or rich countries, and low resource setting areas are poor patients or poor countries. Government screening in developed world is done for neurotube defects during this time period. A blood test in majority of the developed world is done for this purpose. Then there is a term called anomaly scan. It is very common almost all around the world. It is done by specialist radiologists having experience of obstetrics and gynecology as well. Spina bifida or other anatomical defects are detected with this anomaly scan. Doctor will look at the brain, the heart, the eyes, the genitalia, the limbs, and pretty much everything when they look at the anomaly scan. So anomaly scan is done around 20 weeks of gestation when all of the organ systems of the baby have been formed. And in 20 weeks gestation at or around 20 weeks gestation, the baby's basic shape has been formed. The baby's eyes have formed, the baby's ears have formed, the nose appear, the facial features appear, the brain has developed, the heart has fully developed, the genitalia also start to appear properly, the kidneys have developed, so everything has developed. So all of the organ systems of the body have developed by 20 weeks of gestation. That is why anomaly scan is done at or around 20 weeks. That is why we have put it in second trimester care. Then testing for gestational diabetes and anemia is also done during this time period. Yeah, anemia is very common in developing countries. It is very common in my country, Pakistan, due to the lack of proper nutrition, especially the lack of nutrition for females. So testing for gestational diabetes and anemia is also done during this time period. Regular BP checkup, blood pressure checkup will also be done to rule out pregnancy-induced hypertension. So third trimester care involves the care after 28 weeks till the time of delivery. After the start of third trimester, visits should be done every 2 weeks until 36 weeks, and then every week visit is mandatory after 36 weeks. At this time, the patient should be guided about fetal kick counts. At any time of the day, the mother should be able to feel at least 10 fetal kicks during the 2 hour time frame. And if she's not feeling enough fetal kicks, the female should be encouraged to take cold water and juices to see if she can count to 10 movements during the 2 hour time frame. Most of the times the fetal kicks are way more than 10. They are mostly 20 or 30 kicks during the 2 hour time frames if a kid is healthy inside her mother's and his or her mother's womb. Preterm labor precautions should be taught to the patient as well during this time, such as really painful contractions, fluid leakage paravaginally, bright red bleeding is also a dangerous sign. So you need to teach the patient that when to come to a hospital. So if they start having really painful contractions, if they start to leak the fluid paravaginally, if they are having bright red bleedings, and all of these are the danger signs. Group B streptococcus check is also performed in developed world or high resource setting areas to eliminate the risk of newborns getting infected with this bacteria. This is not done all over the world. This is not done in Pakistan. This is not done in developing country. This is not done in underdeveloped world. But as I am telling you the ideal scenario, so I will include this test as this is routinely performed in developed world, including United States of America. If a female tests positive for group B streptococcus, antibiotics are given to eliminate the vaginal or rectal colonization prior to delivery of the baby. At this time period, at least 2 ultrasound scans are also done to check the growth of the fetus as well as fetal position and amount of amniotic fluid in the placenta and in the uterus. So around 38 to 39 weeks in normal pregnancy, a cervical scan is also done by your attending doctor or healthcare provider. It is done to see whether cervix is closed or dilated more than normal, as can happen in multiparous women. Multiparous women are those women who have given birth to the mm, mm, babies prior to their this visit. So if a woman is having her third or fourth pregnancy, then that woman is called multiparous woman. And if a woman is having her first pregnancy, usually her cervix is tight or closed by the time of 38 to 39 weeks. So membrane sweeping can also be done in some cases to induce labor if the patient's body is ready for delivery. What is membrane sweeping? So basically, the doctor or gynecologist or obstetrician sweeps her finger inside the cervix and sweeps her finger like that 360 degrees by entering into the vagina and going into the cervix. This helps release prostaglandins from the uterus, and these prostaglandins help in inducing the labor normally. Again, patient is checked for signs of anemia or other nutritional deficiencies during the third trimester, especially in low resource settings, because if a patient is having severe anemia or even moderate anemia, the complication rates of those pregnancies are extremely high. So third trimester care also involves prenatal checkups, get regular checkups to ensure a healthy pregnancy. Childbirth education should be given, how what to expect, how to take care of a newborn, how to take care of newborns' health, how to take care of newborns. If breastfeeding, birth plan discussion should be done. Listening to your body, the patient should be taught how to listen to their body. And 20 things pregnant women need to know about third trimester. Your back may ache. You consider your birth plan. Finding a comfy position for sleep can be tricky for the patient. Getting a comfy bra is also important. Hospital bag should be packed. Have a date night with your partner or husband while you still can, because when the babies come, all of the freedoms are lost. Plan how to reach the hospital. Be aware of preeclampsia symptoms. If you can have more vaginal discharge, breathing struggles can be normal during the third trimester because the baby is pressing upwards and your lungs are compressed due to the increased abdominal pressure. Rib pains may be present from the baby kicks. Your bump size is a good indication that all is well and the baby is growing well. You may have pelvic pains. Time for your final midwife appointments is there. Remember to practice self care. You may start feeling very impatient for the childbirth process. Swelling and weight gain are normal. There are few things that might get labor started. Read up on sofa sleep for safe sleep for babies. And anemia is very common in developing countries and underdeveloped world. That is why there is a proposed algorithm for diagnosis and management of iron deficiency anemia and pregnancy. I have added this algorithm for your knowledge. Especially if you people do know about what is ferritin, what is the role of ferritin, and what is the role of hemoglobin levels, then you can easily understand this algorithm. Me being a doctor, this is a routine thing for me. So first of all, we draw the blood of the patient and we check hemoglobin levels or HB of the patient. And if hemoglobin levels are less than 11, then we straight away order serum ferritin levels. So serum ferritin levels are usually considered below normal if they are 30 nanogram, less than 30 nanogram per ml. So if serum ferritin level results come back with less than 30 nanogram per ml, then you need to devise your plan according to the weeks the pregnancy has progressed. For example, if the pregnancy is still less than 14 weeks old, then you need to give oral iron trial and recheck complete blood count in 4 to 6 weeks. And if a patient is in her second trimester, that is 14 to 18 weeks, and hemoglobin comes around 9 to 11 milligram per deciliter, oral iron trial can be given and a recheck of CBC complete blood count can be done in 4 to 6 weeks. But if even after oral iron therapy, the patient's HB is not increasing, then you have to give IV iron. And if hemoglobin is less than 9 gram per deciliter or high risk factors, then there is no other chance. You can't take risk of oral iron therapy. You have to give patient IV iron. And if there is third trimester already kicking in, then you need to recommend IV iron because the time has been lost and the patient is still anemic. So you have to increase the HB of the patient. So if the patient has entered third trimester and the patient's HB is less than 11, then you need to give IV iron. So if the ferritin levels are more than 30 nanogram per ml, then you need to look whether the mean corpuscular volume is the size of the red blood cells in layman language. Mean corpuscular volume, if it is less than 80 FL, then recommended hemoglobin electrophoresis, there might be alpha thalassemia present. But if the mean corpuscular volume is more than 90 or 100, then recommend obtaining vitamin B12 or folate levels because these patients might be suffering from vitamin B12 or folate deficiency. So dosing regimens, I will not go into the details, but oral or dosage regimens are 2 to 3 times daily. Oral iron tablets are there, for example, iron polymaltose complex, iron sulfate, iron fumarate. So basically ferrous fumarate or ferrous sulfate, we call them. And then there is ferrous polymaltose complex. So these iron supplements are given 2 to 3 times daily. And if the patient's HB is not increasing according to your expectations or according to the plan, then you need to give IV iron. So iron sucrose injections are there. Sometimes companies call them iron dextran injections. So basically, iron is bound with complex carbohydrates. So iron sucrose 200 to 300 mg every other day or weekly to replete at least 1 gram iron in the body. And after completion of IV iron, CBC, repeat CBC should be done in 4 weeks. So, high risk factors for development of anemia and pregnancy are bleeding disorders, chronic placental abruption, history of gastric bypass, Jehovah's Witness, multi-fetal gestation. Yeah, if a mother is having twins or triplets, then they are sucking blood like leeches. So you need to give as much iron as needed to the patient. Placenta previa or accreta, these are conditions where blood, I will not go into the details of what is placenta previa or accreta because it will go beyond the scope of this lecture, but you need to know that these are the conditions in which blood loss is more than usual. So our last slide for today is vaccination during pregnancy. So check for immunity of the patient against varicella viruses, rubella viruses. If the patient is not immune, vaccination should be done immediately after the pregnancy, after the process of childbirth. Tetanus vaccination of the mother should be done during pregnancy according to the country's healthcare guidelines. There are different healthcare guidelines in different countries, but tetanus vaccination needs to be done. There are two tetanus shots. One first shot should be given as early as possible, and second shot is given 1 month after the first shot. Flu vaccination should be given to the mother as well. Tdap for whooping cough. Tdap is basically tetanus, diphtheria, and pertussis vaccine is given to the mothers as well. All those adults who are not vaccinated should avoid kissing the baby as many of the times simple infections like influenza virus or respiratory syncytial virus can turn fatal for the neonate. Yeah, you may be having a simple flu, you may be having a simple runny nose, and you keep kissing a neonate or you keep kissing an early infant. What you will do, you will transfer that virus to the early neonate whose immunity is very weak, and the neonate will develop full blown bilateral bronchopneumonia. Yes, the neonate will develop bilateral bronchopneumonia and due to the virus that only caused simple runny nose or simple flu in you. That is why if an adult is suffering from any kind of flu-like illness, any kind of bronchitis, any kind of cough or pneumonia-like symptoms, they need to stay away from the neonates or early infants. So the precautions are needed when adults are dealing with neonates or infants. Now you may ask the question there: what if the mother is suffering from influenza virus? What if the mother is suffering from cough? Then she needs to wear mask all the time. All the time means if she's having flu for 5 to 7 days, then she needs to wear mask for at least 5 to 7 days. So vaccines which should be given to the females during pregnancy is flu vaccine, tetanus, diphtheria, and pertussis vaccine, Tdap, respiratory syncytial virus vaccine, and in some cases COVID-19 vaccine as well. And they should avoid herpes, human papilloma virus vaccine, MMR vaccine, or varicella vaccine, because they are live attenuated vaccines, and the live attenuated vaccines are not recommended in immunodeficient states. So tetanus toxide in children is given, first dose is given in 10 years children, and second dose is given in 16 years of age. And in pregnant female, first dose is given early in the pregnancy, and second dose 4 weeks after the first dose, and that is enough of it. And tetanus and diphtheria vaccine is 0.5 ml, and it is given intramuscularly. Have a nice day. Thank you. Questions, please.
Wow. Um, wow, 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 wow. That is a lot of information, and here come the questions, Doctor. We'll start with Bibi Faziana. Go ahead with your question, please.
Yeah, I could not go into the doctoral details, because if I started going into the extra details, then we wouldn't be able to end it in 1 hour and 5 minutes.
Okay.
Okay.
I would like to ask a question. Would you advise a 40-year-old lady with psychiatric history to get pregnant? That's the question.
She can get pregnant, but you have to look at her psychiatric history. I cannot say that he can't have a baby if the illness is mild. But if she's suffering from some major depressive disorder or major psychotic illness or schizophrenia or anything of devastating consequences, then she should avoid having kids, because the major depression, the psychosis, the schizophrenia, or many disturbing illnesses like these, the mothers end up harming their children. I do not want to use the word worse than that, but they do harm their children. So if she's suffering from a severe psychiatric illness, and I'm not here, the one where a simple doctor cannot decide, a psychiatrist can decide whether she's having a severe form of illness or it is just a mild illness that she can cope with cognitive behavioral therapy, she can cope with the use of medications, and etc., etc. So it is a consultant psychiatrist who can decide whether she can have a baby or not. But if she is suffering from severe psychiatric illness or even moderate psychiatric illness, and she's 40 years of age, yeah, she should take a break. But if she's suffering from some mild illness, she can go ahead with having a baby, because having a baby is a spiritual experience. It is a miracle of the God. It's not some 2 + 2 = 4 science. It's a miracle. And sometimes miracles heal the illnesses which are not getting healed with simple routine medications. Thank you.
Okay, now we go to Ike Edwin. Please activate your microphone. Ike Edwin.
Hello, everybody. Greetings
Hello.
from Nigeria. Please, my questions, they're supposed to be two, but let me start with one first. A woman that after giving birth through cesarean operation and
Okay.
returning of her menstrual period is now through urine, what is the likely cause of that?
Can you please repeat your question? Her menstrual periods are not normal after having a C-section?
Yes, not just being abnormal, but is coming out through urine. No longer normal as supposed to be. Whenever it wants to come, it will come through
Is
urine.
she
You will see
breastfeeding?
the urine red.
Is she breastfeeding her
No,
child?
not at all.
She's not breastfeeding her child and still she's not having her periods, then she needs to go to a gynecologist. But usually it takes roughly 3 to 4 months for the normal menstrual cycle to return to its normal routine.
Yes,
So
you are very
you should give 3 to 4 months to the patient, to the female. And if the cycle is not returning back to her normal routine, even after 4 to 5 months, then you need to consult a gynecologist. But if she's having, if she's nursing her baby, if she is breastfeeding her baby, then it is a natural contraception provided by God to females, roughly 50% of the females, that they do not start normal menstrual cycle for like 7 or 8 or even 9 or 10 months. And this helps the females evade from getting conception again, especially if the partners are not understanding, if the partners are not cooperative, and the partners force unprotected sexual intercourse, they do not wear condoms, etc. And then this is a natural contraceptive uh, for them to just keep breastfeeding their babies and take care of their diet as well.
okay. Please, just a little advice here. A woman that has been pregnant for more than 2, 3 years, that's elongated pregnancy. What is likely to be the cause?
A woman, she's
Yes,
pregnant for like,
2 to 3 years, getting up to 4.
that is not normal. That cannot happen.
Well,
That is physiologically, that is physiologically not true.
the pregnancy is confirmed to be there, but to deliver it has been a problem. It is still there, 1 year, 2 years, 3 years, going to 4.
It's not possible. I haven't ever heard it. I haven't ever read it. I haven't even read it even in some far-fetched research papers. It's not possible.
It's okay. It's okay. Maybe if it's not possible, but I am talking out of personal experience around my environment.
I'm not I'm not saying that you are telling a lie, but physiologically and
So one baby has
biologically, it's not possible.
so one baby has been inside of her for 2 years.
Oh, yes. Yes.
There are some cases, listen, there are some cases in which the baby did not develop in uterus, but the baby developed in some other part of the abdomen. There are some
Yes.
cases, and the baby was not alive, but was not dead. So, and the baby was not a normal baby as well. It was just a living creature who was whose heart was beating and things like that, but that was not a normal baby. So the instances like these have happened, but not some normal pregnancy.
And will that warrant it to be there for years without coming out?
I'm sorry, I do not understand. Kindly, can you please
Yes,
move the mic away from you?
yes, what I'm saying is whether it's abnormal or normal or formed what they call it to ectoplasma or something of that nature out of the womb, whatever be the circumstance, does it warrant that the baby or whatever is the creature will remain there for years without coming out?
You need kindly you just type your question because your voice is breaking. Can you please type your question? I will read your question later from the chat and then I will answer you. Can you please type your question?
Maybe
I will read your question later.
anybody hearing me can at least relate, but let me type it, sir. No problem. Thank you.
Yeah, I will answer your question. You need to type it.
It's
Thank
okay.
you,
Let me
Edwin.
type it.
Let's
Next
go to
question, please.
Ismail.
Good morning, sir.
Good
morning.
evening.
How are you? How are you,
I'm fine,
Ismail? How
sir.
are you?
I'm fine, doctor. Good morning.
I'm ready for your question.
Good morning, everyone.
It's
Thank
almost
you, sir.
it's almost
Yeah.
night here. I'm ready for your question. It
Really?
will be a highly intellectual one.
Thank you, sir. Yeah, my question is this, sir. What are the common nutritional needs for pregnant women? And how can a mother ensure the proper nutrition for a child during pregnancy and infancy?
As we discussed in our lecture, uh, and as we discussed in our previous lecture series on nutrition, so basically, whatever balanced diet is, the mother needs to take that balanced diet. And that balanced diet includes good quantity of fruits, good quantity of vegetables, good quantity of dairy products, good quantity of eggs, and meat products, fish, not high mercury fish, but those fish which are admissible, which are recommended in pregnancy, excluding shark, tuna, swordfish, etc. So she needs to take fish, she needs to take eggs, she needs to take a good quantity of milk, she needs to take good quantity of meat, and she needs to take green leafy vegetables all the time along with fruit. So these are the things. There is no rocket science in getting good nutrition. If she can have dry fruits daily, if she can have dates, if she can have almonds, if she can have cashews, so